Good morning, everyone. First, I'd like to thank the organizers for inviting me again to share with you. And today, my topic is complementary health in modern medicine. And I hope you will learn something from my sharing this morning. Okay, before we talk about complementary health, let us go through some definitions first so that we know what we're talking about, because there are some terminologies which may confuse a lot of people. So for modern medicine, we mean conventional allopathic medicine. For complementary, we mean non-allopathic methods that are used as adjuncts to conventional medical treatments, and usually only evidence-based methods are accepted. Alternative means non-allopathic methods which are used instead of modern medicine. CAM, or complementary alternative medicine, covers all the non-medical methods. Integrative means combining modern and complementary medicine. Holistic health means considering every aspect of life that affects our health, for example, religious, spiritual, lifestyle, social, economic, environment, diet, exercise, etc. But take note, in the past, the definition for complementary was evidence-based non-medical therapies, and alternative applied to non-evidence-based non-medical therapies. But now it's slightly different. And take note, in USA, the word traditional medicine applies to modern medicine, which is totally different from our use. So let us compare the US terminology and our terminology. In US, when they say traditional or orthodox medicine, they mean mainstream, modern, allopathic, conventional medical system. Whereas for us, traditional means different thing, right? To us, traditional means the healing systems practiced traditionally by the various races and civilizations. And here in Malaysia, we have the Indian traditional medicine, which includes Ayurveda, Siddha, Unani. And Unani was actually Hippocratic medicine adopted by the Muslims in Europe and brought to this part of the world. We have traditional Chinese medicine, we have traditional Malay medicine, and in Malaysia, there is also the Islamic medical practice, which is recognized separately from the traditional Malay medicine, even though it's mostly practiced by the Malaysia. And this term, TCM, not to be confused with traditional Chinese medicine, so it is T/CM or TNCM, means traditional and complementary medicine. So our health ministry uses T and CM, traditional and complementary medicine. And in 2016, the Traditional and Complementary Medicine Act, Act 775, was released, and only these 7 areas are recognized: traditional Malay medicine, traditional Chinese medicine, traditional Indian medicine, homeopathy, chiropractic, osteopathy, and Islamic medical practice. When it is recognized, it means it will be regulated, and you can expect proper monitoring of the practitioners, proper practices, and proper recognition of their expertise. Whereas all the others that are outside of these 7, it will not be regulated until a time in future. But globally, these are the 5 domains of complementary and alternative medicine that are recognized. There are the whole medical systems, for example, Ayurveda, traditional Chinese medicine, and you can include traditional Malay medicine and other forms of the Indian systems. Then you have energy therapies, you have biologically based practices, you have manipulative and body-based methods, and you have the mind-body intervention. So these are some of the common CAM practices that are known. You can look at another way. These are some of the others. So actually, there are hundreds, possibly thousands of complementary alternative medical methods or therapies. Some of them are well established, and some of them are only slightly known. But because the field is quite open, new ones continue to be developed, and some just die off, and some become popular. Now, next question is, why go beyond modern medicine? And the reasons are modern medicine still cannot successfully treat or solve many diseases. Now, if everybody is happy with modern medicine, nobody will be looking for alternatives. And some examples are, in the field of cancer, the overall success rate of cancer therapy is still unsatisfactory, despite the billions spent on research, much of it being spent on developing the latest chemo and smart anti-cancer drugs. And there are several cancers with less than 20% 5-year survival rate still. And the side effects of treatment can be horrible. When it comes to hypertension, like other non-communicable diseases or chronic lifestyle diseases, is treated with ever-increasing number and dosage of drugs without reversing the disease. Patients remain hypertensive and drug-dependent for life. Diabetes, incremental number and dosage of drugs often fail to give satisfactory control and avert complications, especially kidney disease, which diabetics invariably develop after some time. So we have to look for other more effective ways to manage our patients. Modern allopathic methods improve the readings, but rarely reverse the disease processes in hypertension and diabetes, for example. Complementary methods, however, often seek to restore the body's health and reverse the diseases. In holistic integrative medicine, all available modalities, medical and non-medical, are considered as potential armaments in the attempts to prevent, reverse, and cure disease. So what are the benefits of integrative cancer care, for example? I'll give two examples, one in integrative cancer care, another one in diabetes, all right? So when you combine modern medicine with complementary medicine, you get integrative medicine. And examples in cancer care, the prevalence of CAM use was found to be 51% in cancer patients in USA in this study in 2019. Young, female, higher educated, and higher earning cancer patients were found more likely to use CAM. And the most common reason for CAM use was to treat or cure the cancers, meaning not just to relieve the symptoms of the disease or the side effects of treatment. So the people have put much hope on CAM to try to treat and cure the disease itself, the cancer itself. CAM used by cancer patients can be a safety concern, however, due to the risk of adverse reactions and interactions with the conventional anti-cancer therapy. So why integrative cancer therapy? This study in Korea, also in 2019, showed that integrative cancer therapy improves survival by 6 to 50%. And this study in India, this report from India, showed that with integrative cancer care, you can improve nausea, weakness, diarrhea, acidity, constipation by 69%, mobility, strength, and stability, sleep and breathing by 65%, and you reduce depression, stress, worry, tension, irritability, and loss of concentration by 64%. And TCM is perhaps the most widely used CAM method in cancer in combination with modern therapy. This review in 2013 showed that of all the cancer patients studied, which include over a 250,000 patients, 28% used TCM only, there is no combination, but 72% used combined TCM and modern medical methods, right? So it is almost the preferred method. It is in fact the preferred method in China, combination of modern and TCM in the treatment of cancer. And don't underestimate TCM, right? This is an example of an article in 2019 that shows that TCM has gone high tech, and the research on TCM is already at par with modern medicine. For example, this paper is on traditional Chinese medicine combination therapies utilizing nanotechnology-based targeted delivery systems, a new strategy for anti-tumor treatment. Okay, being a Qigong practitioner, I must also report to you that studies are also being done on traditional practices like Qigong and Tai Chi and yoga. And this paper illustrates that Qigong improves cancer symptoms. So now it is evidence-based. No more empty claims by Qigong practitioners. And to illustrate the move towards integrative management, that is a combination of modern medicine and complementary medicine, is what is done in perhaps one of the most active integrative medical centers in the world, the MD Anderson Cancer Center of the University of Texas. You can see what they do. They combine everything in a holistic manner, right? A comprehensive one-stop center for the cancer patients where they get the necessary modern medical management and appropriate social support, and then also the complementary methods available to them. Even though probably the stress there is for the complementary methods are mainly in supportive and not in treatment of the cancer because they are heavily evidence-based, but you can see that they have embraced the complementary methods in whatever way that is proven to help the patient, either as treatment or as supportive measures. What are the benefits of integrative medicine for metabolic syndrome and diabetes? So this study in 2014 showed that Chinese mind-body movement therapies, that is Tai Chi and Qigong, could offer dramatic health benefits for people with chronic conditions such as diabetes or obesity. And this confirmed the findings of a previous study in 2009, which had showed that Tai Chi and Qigong improved HbA1c, blood pressure, body weight, and waist circumference. And participants also showed improvements in mental health, strength and flexibility, sleeping patterns, immunity, pain reduction, and quality of life. So you can see now it is evidence-based that Tai Chi and Qigong helps metabolic syndrome. Another study in 2018 showed the effects of Qigong on type 2 diabetes. A systematic review and meta-analysis, right? And compared with no exercise, Qigong had significant effects on fasting and postprandial blood glucose. And compared with no exercise, Qigong had significant effects on HbA1c. So you might say, wow, that's comparing with no exercise. But there's also compared with those who did aerobic exercise. And the result was Qigong was better than the aerobic exercise group, and the difference was statistically significant. Right? Another study had shown that aerobics is superior to resistance training in lowering HbA1c, which means Qigong is superior to aerobics, which is superior to resistance training in lowering HbA1c and therefore improving diabetes. Okay, but of course, you get the best results if you combine all three. Yoga improves glucose control, 2018 study. As little as 10 minutes of daily yoga practice combined with standard medical care could improve metabolic health significantly. Different yoga postures or asanas have been found to affect one or more of these. All right, so this is interesting, but the different postures affect different aspects of the improvement. Pancreatic beta cell function, increased insulin production, reduce insulin resistance, increase glucose uptake, reduce fasting glucose, reduce postprandial glucose, and improve overall glucose control. Of course, if you do all the asana, you will get all of these benefits. So again, it is not a blind claim now that yoga improves glucose control in diabetes. It is evidence-based. So what are the challenges in trying to integrate modern medicine with complementary medicine? The safety and efficacy of many CAM therapies are unknown due to the lack of proper studies. Lack of funding and opportunities for research will make the first item difficult to achieve. Lack of training institutions and professional development programs and non-standardized protocols being used by different therapy providers. Lack of control on competency of therapy providers. So here in Malaysia, so something being done, the Act 775, all right, of 2016 has already been proclaimed, and it will be fully enforced soon. Lack of medical doctors willing to explore integrative practice, preferring to remain in their comfort zone. And last but not least, CAM therapies mostly not covered by insurers. So that would also discourage people from going for CAM therapies. Fortunately, there are doctors who have embraced complementary therapies and are even practicing this either themselves learning some CAM methods and practicing, or working together with CAM practitioners. For example, this is the Association of Integrative Medicine Malaysia, a pioneer integrative medical organization. And then we have the Malaysian Association for Advancement of Functional and Interdisciplinary Medicine, MAFIM. All right. And here, interdisciplinary medicine is defined as the interaction between conventional and complementary medicine, not the interaction between the different disciplines within modern medicine. I'm glad to say that I am a member of both of these organizations in trying to promote integrative medicine. Conclusion: complementary medicine remains as an important contributor to health maintenance and prevention and treatment of diseases. There is evidence that some complementary therapies may improve certain diseases. For certain cancers, diabetes, and possibly other diseases, better results can be expected by combining complementary medicine with modern medicine, especially in an integrative manner. Medical doctors should embrace evidence-based complementary methods that work and recommend them to their patients. Integrative medical practice should be the norm in future, and integrative medical associations should be more active in promoting the practice. Thank you very much, and thank you for your attention.